Olecranon bursitis, or swelling at the tip of the elbow, can occasionally be a tough problem to overcome. In this video, I discuss what the condition is and why it can be hard to get the swelling to go away. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions that you've left me in the comments to the videos on my channel. Very straightforward question this week, but one that represents a condition that a lot of people have. It comes from @DerekBit1. He writes, I developed mine, olecranon bursitis, after a snow skiing fall. It's been almost 3 months. It won't go away. Using ice, compression sleeve, and rest, no help. All right, before I answer Derek's question or discuss that topic, please understand I am not giving medical advice in this video. This is meant for general information and educational purposes only. Olecranon bursitis, before I get to the why it won't go away, is this big area of swelling on the tip of your elbow. We all have a little fluid-filled sac called a bursa right there that prevents friction as our elbow goes through a range of motion. It can get inflamed due to some sort of either friction, repetitive use, or more commonly, either a direct blow to that area, as Derek describes, or constant pressure on that area. You see it in truck drivers that rest their elbow on basically the window frame of the car. You see it on top of the kneecap or patella in people that kneel a lot, carpenters, mechanics, things like that. The treatment for it typically, yes, ice compression, sometimes a compression sleeve will be enough to get it better. Occasionally, you can try to draw fluid out or do a steroid injection to not only get rid of some of the fluid, but also decrease the inflammation. That can help. Sometimes anti-inflammatory medications can help. Typically, all of the above. If nothing's working, what we typically talk about is a small surgery to go in and cut that bursa out. As for why sometimes it can be hard to get that to go away, and you can tell this when you do it surgically, if you open it up, it's not just an empty fluid-filled sac. It's not like a balloon. It resembles more of a beehive, a honeycomb, where there's these little loculations and little tissue walls within that bursa that makes fluid not travel from one part of it to another. So even when you stick a needle in it and try to draw it out, a lot of times you won't get that much out, or it'll still be swollen. That's why all that fluid is sort of spread out among a lot of different compartments. So the treatments are still the same on the front end, like what Derek describes. Ice, anti-inflammatory medication, sometimes a compression sleeve, certainly limiting pressure on that area. Then if that doesn't work, yes, you can try to aspirate it. I've not seen terribly great results with that. Sometimes a steroid injection, but I would limit how frequently you can do that, because I've seen with bursitis that other physicians have injected. I've seen what's called a septic bursitis, where that bursa gets infected, and then that's an urgent surgery that's necessary to clean out the infection. But if nothing is working, a small outpatient surgery, just make an incision maybe about that big, basically take that bursa out. That is usually enough to overcome the problem. If you want a copy of my ebook, The Arthritis Solution, you can get that free. Just click the link in the description below this video. If you have an orthopedic injury and you want to hear about options other than surgery, other than cortisone shots, click the link in the description under this video, fill out the contact form, and you can learn more about scheduling an appointment to see me. I'd also love to hear your experience with your injury. Leave those in the comments below. Just understand, if you leave a question in the comments, like here, I can't offer you medical advice, but I might answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.